Are women allowed to want to lose belly fat? The metabolic health conversation we're missing. That's what we want to talk about today. I'm Valerie. I'm a nurse practitioner. I actually have a focus on mental health.
And I'm Jessica Brandt. I'm a health and life coach, and I work with midlife women on all sorts of goal setting and metabolic issues.
And we're the owners of Brandt Wellness. We're a local brick and mortar clinic in Tumwater, Washington. I just wanted to have a conversation today that I think is missing. I will say this. I've been talking to other practitioners, to patients, and there's all this talk about wanting to lose weight. And then there's this sort of attitude about like, it's not okay to lose weight. There's this underlying message that women want to lose weight, especially around their midsection, that's like somehow shallow or problematic. I really just want to take an opportunity to flip the script and just say we're missing the whole medical conversation when we limit it to that nuance of like skinny or fat. It's like, no, we're missing the medical side of it.
Yeah, we're not even talking about the right thing.
Yeah,
Exactly.
I would say that basically it's not about vanity, it's metabolic health. And that's something we want to dive into today, is talk about metabolic health and why women aren't asking to be skinny. And nor do I think that working with women and teaching them about metabolic health somehow makes them, it's actually better for the conversation. It seems more productive and more useful for their health and longevity in the long run.
Yeah, and you as a psychiatric nurse practitioner who works with women in midlife, you see this every day. And mood, metabolism, hormones, and weight regulation, they're deeply connected. And we can't talk about one without talking about the others.
Right, exactly. And as a health coach, you work with women who kind of have a big focus on, what am I doing? What do I need to do? Help me change the habits, help me do the things. And so we're going to talk a little bit about how that all kind of plays in together. So just the first thing we want to talk about today is women are not asking me to be skinny.
Right.
And I don't frame the conversation that way. And I don't think you do either.
Nope.
Women usually come in, they're like, I'm inflamed, I'm puffy, I have no energy, my brain is foggy, all my weight is in my stomach, I work out, I don't eat junk food, and I cannot lose weight.
Yeah, and all these start in their 40s. Usually that's what we've been noticing. And they really notice that the strategies that worked for decades just stop working. Like they can't do the same things. And there's a lot of reasons for that. Belly fat is different.
And usually what happens when we have belly fat, I call that visceral fat. There's all these different words that get used. But basically when we have fat stored in our midsection, that's like that first sign of a few that I'll go over of a metabolic issue, right? So that means our insulin is not working. I call it insulin resistance. And insulin resistance is a very fancy way of saying it just doesn't work as well as it normally should for a healthy metabolic person. Insulin sensitivity is literally the opposite of metabolic resistance. So what's happening is when you have a lot of adipose tissue in your midsection, which women don't like,
Right.
also, your body doesn't like it. It causes inflammation in your body. It worsens your insulin resistance. And it disrupts all that metabolic signaling. And I just want to say that, it's one of a few markers that I'll talk about of a sign of metabolic syndrome. So actually having weight in your midsection, it's not vanity wanting to lose it. It's actually something that's good for your health to tackle that and lose that. So I just want to focus the conversation there.
Let's talk about metabolic syndrome. So tell me more just about what it is. What are some of the clinical markers? Like, what are you looking for?
So when I think about metabolic syndrome, a couple of things jump out at me. One, you are at higher risk for heart attack. You're at higher risk for stroke. You're at higher risk for type 2 diabetes. Nobody wants those things. We do not want to have those things, right? So when I'm thinking about metabolic syndrome, I'm thinking of 5 things, particularly waist circumference. So for women, and I'm going to focus on women, I'm not going to talk about men today. For women, if your waist circumference, get out a tape measure, if it's over 35 inches, that is a sign of insulin resistance. So if your midsection is more than 35 inches, that's one marker of a metabolic dysfunction.
Can anyone with 35-inch waist be healthy?
I would say that that's a fair question that has a lot to do with body composition.
Okay, which you're going to get to.
So maybe an athletic person may have that, but the average woman is somewhere between, let's just pretend, no more than 5'8". 5'8" or shorter. So we're also dealing with the height thing, but I don't like to even talk about BMI. I talk about waist circumference. For women, the general rule, and I know there's always outliers because we're humans, but like 35 inches for women. If your waist is bigger than that, that's one marker of metabolic dysfunction. That's a sign that you are storing extra visceral fat, adipose tissue in your midsection. Okay. The second thing is triglycerides. Anybody who gets a lipid panel done will get the cholesterol levels, but the triglycerides in particular, if those are over 150, that's another marker. The flip side of that is on your cholesterol panel, HDL That's the high density lipoprotein. If it is less than 50, that puts you also at one of those markers for metabolic syndrome. Blood pressure above 130 over 85. So again, high blood pressure is our fourth marker. And our fifth marker is a fasting glucose that's over 100. So whenever you get your annual lab work done by your doctor, they usually are checking your lipid profile, which is going to give you your HDL triglycerides. And they're going to check your blood pressure, and they're going to check your fasting glucose. So those three are lab markers. And then again, blood pressure gets checked, and then your waist circumference. If you have 3 out of these, you have metabolic syndrome, you have insulin resistance. And that's a problem.
Yeah.
Again, nothing to do with vanity. This isn't about being skinny or not skinny. We are now dealing with a metabolic issue.
Yeah.
And then that puts us at risk for heart attack, stroke. And that's something none of us want. And type 2 diabetes. None of us want to be managing those chronic illnesses. They're debilitating.
And here's, I think, what will surprise a lot of people. It's just how common this is. Metabolic syndrome is incredibly common. And depending on the data set, somewhere between 1 in 3, nearly 40% of American adults meet the criteria. So that means millions of people are living with metabolic dysfunction, and that significantly increases long-term disease risk. And women often begin noticing the first signs during perimenopause. So let's talk about what happens during perimenopause.
So really what's going on in perimenopause is we're having hormone fluctuations, particularly estrogen levels fluctuate and eventually decline. And then several metabolic changes happen because of this. And then so what happens is our insulin sensitivity decreases. And what's the opposite of insulin sensitivity? Insulin resistance, which we had just talked about. Cortisol signaling becomes more dysregulated for stress and sleep disruption. And how many of your patients deal with sleep disruption and stress management issues?
Almost all of them. It's something we all talk about at some point.
Yes.
Yeah.
And then we get into muscle mass, right? So we have less muscle mass. We can lose muscle as we age as well. And that's a huge part of our metabolic health. When our muscle mass decreases, that also puts us at risk for that metabolic issue, because muscles, on the flip side, are like glucose burning sponges. Like that's what we want to have to help protect our metabolism, help it work efficiently. All these shifts together create a metabolic environment where weight gain around the midsection becomes way more common. And I would imagine a lot of you hit a certain age, maybe 35 to 40, 50, and you noticed weight in your midsection just came out of nowhere.
Yeah, you haven't changed any of your habits, and suddenly. So I'm curious, I have a lot of questions, because we want to talk about why is this also a mental health conversation? I mean, this is where your field, psychiatric medicine, intersects with metabolic health. Big time, big time. And I feel like in psychiatry, we have to have this conversation about metabolic health for a couple of reasons. One, we have to own up to the fact that some of the medications we prescribe can cause or worsen a metabolic syndrome or metabolic dysfunction of some kind. And then I want to bring this up because insulin resistance and metabolic dysfunction don't just affect your weight. They actually affect your brain. And I think that part really gets left out of the conversation a little bit. It's associated with depression, anxiety, cognitive fog, fatigue, sleep disruption. How many women do you meet as a perimenopause coach that are complaining of some of these or all of these symptoms? It's 1 to 2, if not most of those, at some point during our conversations. But it's because it's tied to their metabolic dysfunction.
Yes.
So surprise, surprise.
Yes. And I think a lot of women feel like my body has changed, my brain has changed. I don't know what happened. I hit 35, I hit 40. It's like my brain and body have changed. They're linked. Of course they both changed. It's hard to separate them. So I kind of feel like if we describe the metabolic shift and the metabolic signaling and the biology behind it, we can understand why women in this age group are noticing changes in their midsection and their brain and their mood. We have to talk about all that together.
So how can we reframe this whole conversation about fat, skinny, midsection? So when women say they want to lose weight around their midsection, I don't hear vanity.
No, I don't either.
I hear someone noticing a metabolic signal.
Yes.
They care about waist circumference, and it's not about chasing thinness, right? It's about wanting to restore metabolic health, energy, and their brain function.
Yes, exactly.
So what actually helps? I'm going to say this.
Being skinny,
Fine.
I don't even like that becomes kind of a word we're supposed to shy away from. It's not about being skinny. It's about having a waist circumference that has a healthier metabolic profile. What we don't want is aggressive dieting, and we don't want punishing exercise. We don't want calorie restricting. Those things are not helpful, okay? Let's just start there. What we want to do is restore our metabolic stability. And that usually involves supporting insulin sensitivity, improving our muscle mass through strength training. So like weightlifting, your strength training. Somebody asked me the other day, well, I don't even know what strength training means. It's like building muscle, lifting heavy things. Sleep regulation, getting better sleep. That helps a lot with our stress hormones. Nervous system balance, inflammation reduction, and then sometimes medications like GLP-1 therapies when appropriate. They can be a real game changer for people who are struggling and feel very metabolically stuck.
Yeah.
They're doing the right things. They're exercising. They're eating well. They're sleeping. They're managing stress. And that midsection is still hanging on. They're metabolically needing a boost. And I don't think it's wrong to ask for help in that.
And this is a tool. GLP-1s are a tool.
Yes.
And they support all the other lifestyle changes that our patients are making with strength training, with sleeping, with eating well.
Yes.
So this conversation about weight and women's health has just become very polarized. On one side, we have shame.
Yep.
The other side, sometimes we dismiss legitimate metabolic concerns. But the truth is, it's more nuanced.
Way more nuanced. And I
And-
think that's what makes me nuts, if I'm being honest.
Yes. Like women are allowed to care about our bodies.
Yes.
And many times what they're noticing is their body asking for metabolic support.
Yes.
And they're shamed for it. And that is not okay.
Right. It's not a shortcut. It's so unfair. And I just want to say that again. It is so unfair that women feel bad about wanting to talk about weight, wanting to talk about weight loss, because if they say, I'd like to talk about weight loss, there's this immediate gut reaction of like, why do you want to be skinny? You don't have to be skinny.
Right.
It's not about that. It's way more nuanced. And again, we're missing the medical side of things. We're missing the metabolic piece. And I just want to reiterate that that's a big deal. And we really focus on metabolic health and mental health because they are intertwined. You cannot separate them.
For wellness, the focus isn't thinness. It's when the brain and metabolism are supported at the same time, women often experience improvements in their mood, their energy, their cognitive ability, and their body composition, which is sometimes the thing that does maybe bring them in, and we don't make them feel bad for it.
If you're a woman in your 40s or 50s and you've noticed a change in your mood, change in your metabolism, change in your body composition, you're not imagining it. That's exactly what we do here at Brandt and Wellness.
And there are ways to support your biology through the transition. And that's exactly what we do.